Well, I'd like to welcome everybody here today for the launch of the Illinois Kids Count Data Book, Investigating Opportunities for Children Now. The Illinois Kids Count Report is an annual look at data that examines the quality of life of children throughout the state of Illinois. It informs state leaders who make policy decisions that affect the well-being of children. We want them to make smart decisions that set the course for a prosperous future for all children. That's why it's important that we're all here today to encourage collaboration between families, local organizations, business leaders, advocates, policymakers, and everyone who cares about children in Illinois. We all have responsibility to our children to prepare them for the future challenges they will face in work and life. The Illinois Kids Count is produced annually by the Voices for Illinois Children, an advocacy organization that has worked for more than 20 years improving the lives of children and giving opportunities to all students for success in school, work, and life. I'd like to thank our speakers, Patrick Urick, Michael Steffen, and Martha Herm. I know we're all eager to focus on the challenges facing children and families, and especially on the solutions we hope will make a difference in their lives. Now I'd like to review just a couple key findings from the Illinois Kids Count 2012 book, and they are available on the back table if you have not gotten one, okay? Early childhood programs, child care assistance, prenatal care, children's mental health services, and after-school programs are all greatly impacted by the state's budget crisis. In 2010, 1 in every 5 Illinois children are living in poverty. Peoria County, that number is 23% of all children in Peoria County live in poverty, with a statewide average of 19%. Racial, ethnic disparities in family income have widened, within African Americans and Latinos having the highest child poverty rates in the state of Illinois. Peoria's median household income in 2012 was $48,748. That is 9% below the statewide average. 1 in 4 Illinois children resides in single-parent households. Illinois, on a positive note, Illinois has made substantial investments expanding health care to children. In 2010, less than 5% of the children in Illinois lacked health insurance. This is one of the lowest in the nation, and we should be very proud of that statistic. Now, in the area of academic achievement, Peoria School District reports 75% of their total enrollment is defined as low income. The statewide average is 48%. Peoria School District 150 has a graduation rate of 77%, lagging behind the statewide average of 84%. We have a lot of work to do in the state of Illinois. So, I'm glad you're all here. We have dynamite speakers that are going to talk to you about what they're seeing. And we're going to start first with Mr. Patrick Urick. He is our city manager. He oversees the day-to-day activities of the city of Peoria, including the $169 million budget and 14 departments and approximately 710 full-time staff and part-time employees, and instilling the value of excellence in public service within the organization. He's had a career in Lake County in 1993, where he was the public administrator. He's been the County of Peoria's administrator for 10 years, and is on April 13th of 2011 became the 18th city manager for the city of Peoria. He holds a master's degree in public administration from the University of Illinois at Chicago, and it's my pleasure to introduce Mr. Patrick Urick.
Thank you. I'm going to have to get that bio updated. There's a couple of tweaks, and then we actually have fewer employees, and that's actually what I'm going to talk about for you today, is the impact that we've seen economically and how that affects the community at large. And then you'll see as Michael and Martha talk later that there's they can bring it down to the social service agency level. But I think it's important to note that the economic downturn in the economy over the last several years has had a dramatic impact. And then there's really this perfect storm that's occurred as well with this, in that what we've also seen is that we've had other legacy costs that we've had to carry, just like the state, and that's causing an impact on service delivery at the local level. An example of that would be, and Clete made a nice job of talking about the larger economic indicators, but if you break it down at the state or at the city level, there's some things that I want to talk about. From the state income tax standpoint, due to the state's fiscal challenges that they have, right now they're currently 5 months behind on paying us their state income taxes and on remitting that back to us. That's about $3.5 million that we're seeing that's an impact to us. And that has a direct impact on our ability to deliver services and our cash flow. And from that, I think we could see that we've looked at that and said that the interest costs alone are about $35,000. Well, $35,000 is an entry-level salary for many positions that we have in the organization. In addition to that failure to make the timely payments, what we've also seen is that we're really seeing our income tax levels and our other tax levels for sales taxes and other economic-based revenues are really coming in at a 2006 level where we were 5 years ago. So economically, we've had a reset in terms of our economy, and we've seen that we've really stepped back 5 years in terms of what we've been collecting as far as tax revenues. That has an impact on service delivery as well. Looking at that, we've had to then make some additional changes just to keep and try and balance our budget so that we could provide the services that we have to at the city level. And that means that we've had to impose a natural gas tax and a utility tax as well, a national gas utility and a water utility tax of 5%. That has an impact on social service agencies as well, because they have to pay that utility tax just like we do at home. And that has an impact on their bottom line, and that's something that we recognize. It's unfortunate, but it is the case. Because of all of these things and our fiscal challenges, we've seen that our employment base has gone from 864 employees in 2002 down to 659 employees this year. So that's a 25% reduction that we've seen in the number of employees that are providing services, police services, fire services, planning services, engineering services in our community. That's a huge impact that we've seen, and it has a detrimental effect at our ability to deliver services, and that's something that we have to recognize, and that's where that bio has to be changed, because it says still 710. Over the last 8 years, though, we've also put in nearly $7.5 million more into our retirement funds in order to make sure that we're adequately putting reserves away for our pension plans for our employees. That's $7.5 million more that we didn't, that in good times you wouldn't necessarily anticipate having to do. It's a very similar situation to what the state's having to do right now in terms of trying to tackle the state pension crisis. So it's a big challenge that you see that ripple effect occurring at the local level as well. For us, what's also happened is that we've seen that our unfunded liabilities for pension services and for post-employment benefits has grown during that same time period, that same 7-year period, from $60 million to over $290 million, almost $300 million. So that's the growth, and that's one of the challenges that I think you'll see on the state level, and that impact that we have in terms of trying to deliver services. And this is the big challenge that policymakers and that managers like myself have to try and deal with at this point in time. So this fiscal pressure, just like here in the city of Peoria, has forced state policymakers in Springfield to focus on shoring up their deficits and focusing on that. And this year, when we presented a proposal in the budget, we talked about contemplating within our Human Resources Commission taking the funds that we provide to social service agencies and possibly directing that into policing, some of the core services that we have to provide. The policymakers took that into consideration and said, no, we don't want to do that. And that was something that they said, no, we know that's one aspect, but the social service agencies that are out providing services to children are very important for our community, and it's something that we need to ensure that we're still providing. So investments in the well-being of children are proactive investments that pay off dividends for generations. And I think what we've seen is that when we, as government, tend to work in the other direction where we don't provide those investments in children, that we'll see that it ends up causing governments at all levels to be reactive instead of being proactive. And it's, you know, it's the statement about an ounce of prevention, and I think that's something that's very true, and that investment in children is an investment that we need to be making. And the release of this data book, I think from my perspective, and I'll just close with this and turn it over to Michael, is that it's really important because it's an excellent compendium of data statistics for policymakers, for researchers, for social service agencies. It shows it gives you that pulse of what's going on with children and what's going on in our community. And I think that's something that we need to recognize and really applaud Voices for Illinois Children for putting together a very valuable tool. So thank you very much.
Thank you, Patrick, for your wisdom and thought. We know it's been a challenge for you and will continue to be. We appreciate you being here. As Patrick has talked about the macro level, he's seeing it from a 30,000-foot perspective working in a municipality. But the next speaker is really representing an organization that keeps their finger on the pulse of our community right here in our own backyard. The Heart of Illinois is really that entity that watches for the well-being of our community and really drives then funding initiatives to where the need is the greatest. Our next speaker is Michael Steffen. Michael is the president of the Heart of Illinois United Way, which funds over 100 programs. He was named president of the Heart of Illinois United Way in January of 2000. It's interesting, after reviewing Michael's bio here, he's been in very sunny, warm climates over his career and has come here to Illinois. But from 1992 to 99, he was the director of Major Corporations Division for the United Way in Washington, D.C. In 90 to 92, he was the division director of the Valley of the Sun United Way in Phoenix, Arizona. From 87 to 90, he was an associate campaign director of United Way in Metro, Oklahoma City. He began his career with the United Way of the National Capital Area in Washington, D.C. as a loaned executive in 1986. He has a bachelor's degree in business administration from James Madison, and he's married with 2 children and very involved with the community. So our next speaker, Michael Steffen.